We're going to begin. Hello, everyone. Good morning and good afternoon, depending on where you're coming from. Welcome to our webinar on the Canadian Campus Wellbeing Survey. I'm Sandra Ewan, one of the co-leads of the Best Practices Network. We're very excited to have colleagues from campuses and organizations across Canada joining us today. And before we begin, I'd like to begin with a land acknowledgement. We are all viewing and participating in this webinar on traditional territories of Indigenous peoples of Turtle Island, and we want to recognize their contributions to this place and express our gratitude for our ability to come together and learn today. To assist with our learning for today's session, there are just a few items I'd like to go over. All participants will be muted to enhance the audio experience, and today's session will be recorded and will be made available on the Best Practices website following today's session. We encourage you to use the chat and to ask questions or comment throughout the session, and there will be a Q&A at the end of the session. Feel free to use the chat now to introduce yourselves to each other, letting us know what your role is or what institution you're coming from. If we do need to end the webinar abruptly, we will reschedule the session and reconnect with all of the registrants with a new date and time. Just like to begin with a few introductions. First, the Best Practices Network is a national mental health community of practice and knowledge exchange network. Our goal is to promote and advance evidence-informed and evidence-based student mental health and wellness initiatives to improve Canadian post-secondary students' health and well-being. Our network began as a formal partnership between the University of Toronto, Queen's University, and McGill University, and more recently, the University of British Columbia joined in a capacity with the CCWS. I'd like to introduce my colleagues and co-leads from the other campuses. Dr. Reena Gupta from Queen's University. I hope Lena's there, just give us a wave. And Dr. Lena DiGenova from McGill University. So today, Guy Faulkner and Kelly Wunderlich from the University of UBC are joining us. They will be presenting on the CCWS and reporting on provincial data from British Columbia. They have two guest speakers, Jeff Burrow and Matt Dolf, who will provide a perspective from their different campuses. I will now turn it over to Guy and Kelly. I hope you enjoy today's session. Thank you.
Thank you, Sandra. And good morning or good afternoon, everyone, and happy Pink Shirt Day as well. I'd like to start off by acknowledging that the land on which we gathered here at UBC, where I'm speaking from, is the traditional, ancestral, and unceded territory of the Musqueam people. And I really thank you all for your interest in hearing more about the Canadian Campus Wellbeing Survey. I will be giving a little bit of an overview of the survey. I don't want to spend too much time talking about the nuts and bolts of the survey. You may have been to earlier webinars that we've done about development of the survey. And there's a lot of information about the survey also on our website that we'll show you at the end. But I'm going to spend a little bit more time giving you an overview of some of the data that's been collected so far, really with a focus on how the data is shared back to institutions. And then I'm going to share the stage, and I'm really excited and thankful and grateful for Jeff Burrow and Matt Dolf to be present today to talk a little bit more about how they're using the data, because that's what is the most important part of this whole enterprise, is not just collecting data for data's sake, but actually ensuring that it has some kind of impact and policy and practice. And so really where we're at with the CCWS now, as we're just about over 60 institutions have or will be participating in the CCWS, is starting to look at how this data is having an impact. So I look forward to that discussion and then a Q&A. Next, Kelly. So let's start off with an overview of the CCWS. So again, how this has come about was really with a vision that has been percolating for at least 10 years of trying to develop a more comprehensive and coordinated evaluation system for Canadian post-secondary student mental health and physical health and well-being. But really trying to create a system that integrates not only just the data that is collected through surveillance, but it's starting to be used to evaluate practice and then inform strategic direction regarding policy and programming. We're looking at developing a system that has national implementation, that is available to colleges, it's available to universities, It's available to French-speaking universities. It's available for English-speaking universities. It's also potentially available for employees. And again, that's something that I'm not going to spend too much time talking about today, but where we started off by developing a student-level CCWS, it was always created in the mind to look at taking a campus-wide approach and that it would start to open out to be also accessible for employees. And we have started that process and we'll be piloting an employee version of the CCWS very soon at UBC. Next slide, Kelly. So again, this is the kind of that conceptual model, which again, I come from, I'm a professor in applied public health. I come from a research background, and I'm particularly interested in looking at how we create these systems in order to inform practice. So this kind of data collection activities, that box in the top left corner, that's the CCWS, that we're creating machinery that allows for collecting student level data about health and well-being. But again, ideally, that is then used by institutions to inform what they do. How do they translate this knowledge, this research into practice? How do we intervene at an institutional level? And then if we evaluate those intervention activities, either through CCWS or other means, then we start to add to that kind of data collection process, and we start to learn what works, what doesn't work, what works for whom in certain situations. Next slide. If we boil down to what the CCWS is developed for, firstly, I do consider it as a quality assurance exercise, that it's to be used to guide post-secondary institutions in assessing prevalence and correlates of mental health, physical health behaviors. It's to be used to inform decision-making about where we should be prioritizing health service dollars. Participating institutions also, their data is collected, included in an anonymized data set, which then allows for comparing and contrasting to similar institutions or to any kind of benchmark that might be of interest. And that's, again, where the exciting part for me is trying to learn where we can see perhaps in some institutions pockets where there is a low prevalence of poor mental health, or there is high prevalence of physical activity. Can we start to tease out what it is that institutions might be doing that is associated with well-being, and that we can then use that information to share with others? There's also a research data set to the CCWS that again, the data is collected, goes into a database, and researchers can access the data set sometimes for a fee if it costs money, if it takes time for a data analyst to prepare the data. And again, that's to be in line also with interests of other parties. So the Public Health Agency of Canada, for example, are very interested in prevalence of vaping at the moment and are interested in using the CCWS data to look at how that changes over time. I'll talk a little bit shortly about the work of the Mental Health Commission of Canada, for example, and the post-secondary standard and how the CCWS aligns with that and could be used to assess its implementation. Now, again, that is all governed by a data access committee, where the important kind of principle is ensuring that institutions are not identifiable in any of that shared data sets with researchers. Next slide. So a little bit about survey development. We started, it seems like eons ago now, in terms of a stakeholder mapping process, identifying the priorities for measurement within a national survey of student health and well-being. We then had a meeting with experts, primarily epidemiologists, to identify what are the best measures of those priorities. And they were very much aligned with existing Canadian population health surveys. So again, we weren't creating any new questions. We were pulling from existing national surveys to aid comparison. 2019, we looked at feasibility, reliability testing of the survey at UBC in Sheridan, piloted in November 2019, and then we actually deployed in British Columbia in the spring of this year, mostly just before COVID. In the fall of 2020, the Atlantic region has participated, and currently Saskatchewan is participating in the CCWS. And the survey is now available for any institution that is interested in employing it. Thanks, Kelly. So these are the core domains. Again, I don't want to go into great detail about these. That again, there is a technical document on the website that talks about what these domains are and how they are measured. But again, these were the ones that we were trying to engineer into at max a 20-minute survey. And so we really had to make some tough decisions about what got into that survey. But what we do have is some flexibility, Kelly, with the next animation, I think, is that it is designed to be a modular system. Institutions have an option to add items, up to 5 items of their own choice. But we're also looking at how do we develop modules that institutions may choose to add to the core survey. So for example, we have one, which is really just a bit more of a development of the food security core domain. But we're also interested in looking at how we may bring in a core set of questions that relate to stigma and a core set of questions that relate to experiences of sexual harassment. Thanks, Kelly. You're starting to predict my pauses mean a slide transition. So just a final point before handing it over to Kelly was, looking at mapping on the CCWS to the standard. And here is just a kind of a quick overview of where we see items from the student level CCWS survey mapping on to outcome indicators in the standard. As you can see, the individual is pretty well covered. Community is pretty well covered. And what the CCWS doesn't get at really is some of the institutional factors that perhaps are probably more likely to be generated through institutional level data. And I think, that's unfortunate about the stigma. And that was just to give you an example of the challenges of developing the CCWS survey and trying it to be as short as possible, is that we just didn't feel we could ask questions about stigma and do it justice within a short survey. And so that's why it's not actually captured at the moment, but I think I certainly acknowledge that there is a need to think about a module that captures that. Thanks, Kelly.
Great. So I'm Kelly, I'm part of the CCWS team, and if you choose to take part, I'll probably be the first contact that you have with us. So I wanted to go over today, as part of this overview, a timeline of what to expect if you chose to take part in the future. So this year we had both a fall and a spring deployment, and often received questions from institutions about when to take part and if there were other institutions from their province in their cohort. So what we're thinking for next year is to encourage all interested institutions to take part in the winter or spring 2022 deployment, so that there's a larger comparison group available. We will still have the fall 2021 available upon request, but it will probably have a smaller comparison group. So again, probably recommending the spring 2022. So on the screen is the recommended timeline, like I said. There is some flexibility, but I think a key thing to take home is not to underestimate the timeline. Often we see if we start to push the dates back, we start to see potential delays in deployment. So although this might seem far in advance, starting to think early about these things. So in spring or summer, it's probably a good time to start thinking about, are there other institutions specifically that you would like to form a cohort with, potentially organizing a provincial deployment. And that's a chance to start those conversations early, maybe even about additional questions at your institution or with your stakeholders. By June, you'll probably want to start working on your RAB application and contact us about a service agreement. And then by October, you can submit those. And by mid-January, have completed your implementation checklist, which is basically telling us how you would like your deployment to go, so that you're ready to deploy in February or March. And then finally, in summer 2022, so about a month after you finish your deployment, we'll send you a raw data set of your data. And then about 3 months after all of the deployments have finished, so that we have the comparison data, you will receive your Tableau dashboard. So I just wanted to bring your attention to this part of our website. I think it's one of the most useful pages on it. So if you are thinking of taking part, highly recommend bookmarking it. It essentially will walk you through all of the timelines and different steps to take part, and the resources that we have available at each stage. So for example, an REB template that you might be able to use, the information package, the survey questions, and so forth. So highly recommend you visiting this. A couple other things that I just wanted to highlight quickly. So we get asked about how the survey works. We use Qualtrics, which is provisioned by UBC. It complies with FIPA, and the data is stored in Canada and is encrypted. And in terms of how we send this out, there are two options. We can either use proxy emails, which is where you send us alias emails for your students, and we send the emails for you. Or you can choose to send the emails to your students. So regardless of which method you choose, we won't receive any student names or email addresses. So we won't have that identifying information. And the last thing I wanted to touch on is the REB approval, since this can be something that often takes a bit more time than expected. So we do require some type of REB acknowledgement. So this typically either means that your REB considers it to be quality assurance, in which case you won't have to go through review, or it might be considered research, in which case you will do review. Or finally, if you don't have a research ethics board at your institution, we will accept a letter instead from a senior administrator. So regardless of which situation happens at your institution, you can send us the documentation. And throughout this, I know a lot of contacts that I've talked to at institutions have never done an REB application before, so that's why we provide the resources like the REB template, and we're also available to help answer questions about the application and help respond to the questions from your REB. So in any case, we're happy to work with you and help you as you prepare, and please check out our website and get in touch if you have any questions.
Okay, thanks, Kelly. So I'm just going to give a very high-level overview of some of the spring 2020 results. And I'll start off by just highlighting again how we provide data back to institutions. We use a platform called Tableau. So we provide raw data back to institutions, but also institutions get access to a Tableau server where they get a report of their data and up to 2 benchmarks, so that you can compare your own institutional data to, it could be the rest of the province, it could be the other U15 institutions, it could be rural colleges across Canada. And so where we've found, we've received a lot of positive feedback from Tableau, primarily from colleges, from institutions that don't necessarily have institutional research capacity to play with the data. The Tableau provides a very user-friendly way of giving the data back, but then also providing interactive charts that can be PDF'd, can print it off and shared, and does the analysis for you. Just the next slide, Kelly. And this just gives you an example of that type of interface. This is data that's completely made up, looking at academic achievements, but you can see, so for example, you've got UBC and you've got other institutions. And again, that's your other benchmark that you choose. So for the BC cohort, institutions were choosing, comparing themselves to BC as a whole, but then also we're comparing, some, well, like UBC, we're comparing themselves to, larger universities and having a benchmark that didn't include the college data, for example. But this provides, again, you can see down the column here that you can start to look at focusing on particular demographic groups, to look at the data more closely. There's information around statistical comparison that also just gives a pretty quick red flag, or not necessarily a red flag, but will highlight where there's a statistical difference and a relatively medium to large effect size, because often the samples are so large that it's usually statistically significant, but we use effect sizes to really indicate the practical significance. So again, it provides you an opportunity to just see where your institution differs with the benchmark, positively or negatively, very quickly. Next slide, Kelly. I just wanted to look at a couple of data points, and this is just looking at the BC data. So 18 institutions participated from BC, over 17,000 students. We were ecstatic to see that 17 minutes to complete, that we were well in our 20-minute range. And the data that I'm just going to quickly show you is largely pre-COVID, that we started this before mid-March. There were some kind of institutions that were wrapping up, but we feel that this was largely unaffected by COVID. I think the response rate is really interesting and an important kind of point to highlight if you just check. Yeah. So this is the response rate. What we've found is that there's some work that needs to be done to enhance response rate. We recommend that institutions are sending at least 3 reminders, that there are incentives, and there's also a communication campaign that goes on, that institutions, and that's part of that, as Kelly was mentioning about the timeline, is that it's not really about just getting things ready, getting the REB and then doing the survey next week, that there need to be some kind of socialization about the survey amongst the student population, amongst key stakeholders and leaders of an institution, to communicate the value in doing the CCWS, and that something will be done with the data. When we see that all the things happen that we you would think are associated with best practice, we see that response rate in BC of around just over 20%. If we see the fewer reminders, no incentives, then the response rate reduces. And that's clearly an ongoing issue for all survey research, and something that we need to look at in terms of what institutions do well and what we can learn from institutions with good response rates. Just the next survey. What we can do, though, with the CCWS is we can link the sample who complete the survey with the sample that were invited to participate in the survey using the institutional cohort variables. So this is quite a useful way to look at how representative your sample is of the sample that you invited to participate. And I think that's a useful mechanism for thinking about how representative your data is of your in regards to the actual institution itself, not necessarily comparing it to more broadly British Columbia, but of your own institution. And so the 2 data points I just wanted to highlight was firstly mental distress. So mental distress. So this is measured through the 10-item Kessler psychological distress scale, measure of depression and anxiety over the last month. And I think when we saw this, of course, the first thing is alarm. Just about 28.7% of the BC sample reporting severe mental distress. But it's interesting when you look back at prior data, so looking at the 2010 Canadian Community Health Survey research using the same question, when it looks at among 15 to 24-year-olds, it's around 29%. Going back even further to an old colleague of mine, Ed Adlaff, who did the first Canadian college survey in 2001, reported 30% elevated distress. So it looks like actually there is, if you're looking at different data points, that the prevalence of severe mental distress hasn't changed dramatically over time. But interestingly, when we look at some of the data, and this is, we need to be careful comparing BC to the Atlantic region. If you did, we do see there is a bit of a spike, as you might imagine, with COVID, of 77.7% of that sample reporting severe mental distress. Just the next slide, I just wanted to give you an example of where something like the CCWS might be useful. This is just some questions about health service utilization and help seeking knowledge on and off campus, where we see in BC approximately 30% of the sample would say that they weren't aware of where to seek professional help for their mental or emotional health. And that's the kind of question that I think we can dig into by starting to look at who are the students who are not aware. What are some of the institutional factors that are associated with explaining that variability? Is there something that some institutions are doing where we see higher levels lower levels of students not being aware of where to seek help? And that's where we can start to share knowledge I think, of where, what institutions are doing if we have that kind of forum where we can start to dig into this data. You can click through the rest of those slides. And just the final point is just the research data set that I mentioned as well, that there is an opportunity to access the data to ask more hypothesis-driven questions that may be of interest for institutions or for individual researchers. And just on the next slide, don't want to spend too much time talking about this, but you may be aware of the recent 24-hour movement guidelines for adults were released in October of last year. And so we were able to use this research database to look at the prevalence of young adults who are meeting the 24-hour movement guidelines. And this is the first paper that has been accepted in a peer-reviewed journal that's using the CCWS data. And of course, half the reason for doing this was to publicize the CCWS research database as open and available for business. And if you just click through, Kelly, approximately 10% of Canadian, of young adults in the CCWS sample are meeting guidelines. Females and older students are more likely to meet the guidelines, which is interesting because it's typically when we just focused on physical activity guidelines, it was males and younger students more likely to meet the guidelines. But now the CCWS is actually being used to monitor the implementation of these new 24-hour movement guidelines. And so that's, again, where something like CCWS can also be used as a research tool. Thanks, Kelly. So I'm going to now hand over to Jeff.
Hi, everyone. Thanks for the chance to speak for a few minutes about the CCWS. Again, my name is Jeff Burrow. I was the manager of assessment for student life at the University of Toronto, and I've been a member of the development and the technical committees for CCWS for about 2 years now. I'm also a person who does a lot of analysis on a lot of other student surveys at the University of Toronto, including NESI, the Student Experience at the Research University, CGPSS, NCHA, and many other things. I've been reviewing the data from the CCWS when U of T participated in. We participated in almost 12 months ago right now, actually. So in February and early March, I believe about 95% of our data was collected before we hit that COVID point. And you can see some of the provincial data that Guy shared before, and you can see some of the, you can see all the questions on the website as well. I'd like to sort of share a few things about ways that I've been thinking about and looking at this data. I will say sort of that, if it's such a thing to have a favorite survey, CCWS is probably my favorite, one of the ones I work with these days. And I think a lot of that is due to the work that Bindu had done earlier and that Michael now does in terms of setting up the tableau. I think I can't stop sort of talking about the power that puts in the end user within the institution, the power that gives them to answer questions that they have and that senior administrators have within a few minutes, I think is really something that's really important to talk about. So maybe on the next slide, sort of three big thoughts here. So thought number one, and I know that I feel bad, Guy used the Bronfenbrenner model earlier on an earlier slide, and I've used some slightly different language here, but I've spent a lot of time really thinking about this idea of how do students think about the institution? How do students think about, traditional health and wellness and well-being services? And then how do students sort of talk about the things they do or the things they feel or the types of services they would or would not engage in? And again, it's not a straight line between any of these things, but I do really appreciate that this instrument sort of does give us these questions that go beyond the actual services and the work of folks that work in health and wellness offices to a much broader sort of campus look. And I think that's important, especially as was mentioned earlier, with whether we're talking about the post-secondary standard or the Okanagan Charter, any of these sort of different types of guiding documents and frameworks that really do talk about a whole campus approach. I think there are obviously other institutional measures we would look like. Having student feedback on how they feel your university, your institution, or a set of institutions, the degree to which they prioritize health and well-being, I think is important data to look at, because I sort of think about how much these things are upstream of what happens within a health and wellness office as well. The second thing I'd like to sort of share for a second here is this idea of being able to look at national data or provincial data and your data, whatever that may be. And again, I've said this and I'll keep sort of saying this. This is easily done for most folks because of the tableau. We don't have to order additional reports. We don't have to share line item data for all of the other institutions across the country, and I think that's a huge thing. So the idea of being able to sort of see data from schools like mine, however you define that. So you can look within a province if there are some provincial consortiums participating, and that gives you a chance to look at, if there are large scale provincial legislation or initiatives, the impact of those. I like the fact that, at the University of Toronto, we are a very large research intensive university. We can be grouped with other similar large scale institutions because we know we have some similar challenges and opportunities at the same time. It allows us to look at that lens, but also sort of, we have a really big population, and all institutional populations are unique. So this idea that we can easily separate our undergraduate and our graduate students, our full-time and our part-time students. All of these things are sort of important, and what we can do very quickly within the tableau, and maybe if you have a data analyst, they could do on their own, but the tableau makes it so much easier, is quickly look for things within your own data and then seeing how similar or different is this to something that is maybe happening on a provincial or national level. Is this something that's perhaps unique to my institution, or is this a trend or a development that we're seeing in other institutions as well? So just as a quick example on the next slide here, I focus a lot on that one question. It's actually maybe one of my favorite questions in the whole survey, this idea of like, at my institutions, I feel students' mental and emotional well-being is a priority. I think 68% of all students sort of scored that on the agree, somewhat agree, strongly agree side. But when we sort of start pulling this apart, we see that the research intensive universities, of which I am part of one, we tend to sort of score lower on this than perhaps some of the smaller institutions or community colleges. So I think, again, this is something you can do in Tableau really quite quickly and start to see some of that institutional variability. And again, really what's the key here is focusing on institutions that have student populations or characteristics that are similar to yours. And I think that's really, really powerful. What can you do with the data after you've done this? If you find a view you like, you can easily, within about 5 seconds, you could download the crosstabs. You can format it into any form of type of design that you want to include in other reports and things like that. So again, the key here is that the row level institute or the system-wide data is locked, but you can download the crosstabs and sort of create things like this to sort of say, here's how my school does and here's how the province does on almost any question or combination of variables you can think of. And the last thing I've been thinking about a ton again, and I work at a very large institution, 90-ish thousand students. 70 to 75% of the students would identify as racialized minorities, perhaps. This next slide, I think, is really, really important for us. So I think about data that's in a student information system and data that's not in a student information system. It doesn't necessarily need to be in one either. But the questions that are included in the survey and the ability to look at all of these questions through the lens of student identity. Whereas before, maybe we're talking a little bit more about student characteristics, about their program of study or their level of study. Here, really sort of focusing on, there's many other levels of this, but these are 3 that we've been looking specifically at. And I do reflect back on the summer to think about how many requests came to my inbox from different senior administrators asking me on all the different surveys we have data on, like, what do we know about how Black identifying students are responding to the different surveys and data systems we have? How are Indigenous students? And again, I can do some of this work on my own, but having this data within our Tableau data set made it incredibly easy for me to pull this data, but also to pull that provincial or system data to sort of say, these are the areas where my institution is perhaps doing a little bit better, or our students are responding a little bit more favorably. And these are the places where we're doing less so. And I just think this sort of entire sort of notion about student identity, especially as it relates to ethnocultural identity, gender identity, and sexual orientation, is a place that we don't have enough discussions on. And the way that this Tableau data and the research, the survey itself have been designed, I think really permit folks to do that. And you don't have to be a full-time data analyst to that. You really need to just be a person who has some curiosity and questions. Pointing and clicking through the Tableau for folks that haven't used it is something you can really come up to speed in an incredibly short period of time. And I think that allows you to get answers to important questions and to share with other senior administrators and leaders a lot faster than you might have been previously. So those are a couple of things I just wanted to share. Thanks.
Over to me. Thanks, Jeff. And thank you for inviting me to be here. I'm really looking forward to this conversation. So I'd like to just acknowledge first that I'm joining you from the traditional, ancestral, and unceded territory of the Coast Salish peoples, the Musqueam, Squamish, Stolo, and Tsleil-Waututh nations. My name is Matt Dolf, and I'm the director of the UBC Wellbeing Office and also co-chair of the Canadian and International Health Promoting Campus Networks. So I'll provide a quick overview of how CCWS has been used at UBC, and mostly with some tactical reflections, since a lot of the data and technical pieces have been covered by others. So for context, UBC has long been committed to embedding health promotion, as well as well-being, equity, sustainability, and Indigenous human rights across our institution, and have a commitment to be part of an international health promoting campuses movement where we share best practices. Our work was significantly elevated at UBC when we created UBC Wellbeing as a university-wide initiative, and also formally adopted the Okanagan Charter for Health Promoting Universities and Colleges back in 2015-2016. And shortly thereafter, UBC also renewed its strategic plan that made commitments to develop a wellbeing strategic framework, and that named specific priority areas for actions across a number of target areas. And in the chat, I just posted a link to where you can find our framework, as well as our annual report that has some high-level data that's largely pulled from CCWS results. But we recognize that in many areas we didn't have data to evaluate progress and inform our policies and practices to support health and well-being of our whole campus community. And so we really, when we do our work, we're talking about undergrad and grad students, as well as staff and faculty, and the 20 or so thousand community members who live on our university lands. And there are many areas where we just don't have good data to inform the work. And so one of the formal commitments that our president and executive made when we adopted the charter was that we would evaluate and report on outcomes annually. And so that has helped us create our reporting process that goes to board, and helped really inform what surveys we're using. And so around the same time that we did that work, the CCWS process started, and we immediately saw the value in being part of that, because it would provide us with validated population health measures for some key areas where we had gaps. For example, in areas of physical activity or food insecurity, resilience and flourishing. And as Jeff was just talking about, my favorite metric as well is, or a global measure that we use consistently, is at my institution, I feel that well-being is a priority, which at UBC was, I think, a little bit lower than what you showed, Jeff. I think it's, for us, it's 44% undergrad and 60% for grad students. And we really want that measure for employees as well. And the other area where we saw value was that comparing results across institutions will really help inform best practices, as Guy was saying, and help put some of the results in context. And then also the ability to analyze the raw data and use Tableau is incredibly helpful, and also helpful for researchers. We have many researchers that have wanted to help use this data and help inform our work and do some of the deeper analysis that we just don't have resources for on the staff side. And I'll talk about an example in a minute. So just to quickly mention how we've used it, we did a pilot student survey last fall. And then this spring we'll run a second student survey, partly because COVID hit, and also partly because we want higher participation rates than we got last time. And we'll launch a pilot employee survey this spring as well. And to give you some context, UBC has 80,000 student, staff, and faculty. So that is a pretty significant and important amount of data to look at health and well-being of our community members. So just to touch on a couple of things we've learned, and I'll give some practical examples of how we've used the data. We've learned, and I've heard this from many other campuses who I liaise with when we talk about CCWS and other surveys, it's really important to build a strong internal value proposition when you're doing this. So in our case, we make sure that we link the need for this to our university commitment to health and well-being, which is why I started with that, and you really can't emphasize that enough. And also talk about how the data will be used to take action. So one of the main ways we do that is, I mentioned our plans and annual reporting processes that goes up to board, but it's also important to report out to the community as well on some of the summary about data and the actions that we'll take. So as an example, we have a university-wide committee that supports physical activity and aims to reduce sedentary behavior. And we have a target set to reduce the prevalence of physical inactivity by 10%, which is also aligned with the WHO goal. So CCWS gave us data that really helped us understand prevalence, not just overall, but by demographics. So our target is global, but also very much with a focus on diverse programming and meeting diverse needs. And we wouldn't be able to do that out some of that data to back up the evidence. And I think on average, I think only 2 out of 5 students right now are currently meeting, sorry, 2 out of 5 students are currently not meeting the Canadian physical activity guidelines. So there's a lot of work to do. And if you're, I'll do a quick plug as well. If you're interested, we've launched a really great campaign at UBC called Move UBC that runs for the month of February. And you can go check out some of the ways that we've put this into practice. As I've said, it's really important to report out on findings, both to leadership and community. So we do that annually. We're also trying to think through how we do that more effectively for the community. And that will really help our response rates, we think, when we're really able to tell students, employees how the data will be used and give it back to them in a timely fashion. So we're thinking through how to do that in the spring, and as well as to spark more opportunities for students and faculty members to be part of leading change and informing use of the results. We've had some really great examples too, where researchers have been able to help inform the work, and we're excited that they could actually leverage a data set like this, that in some cases can be the biggest data set of its kind in some areas. So for example, UBC has been really concerned with the prevalence of food insecurity rates, which hover around 30 to 40% from many surveys that are run across the country. And when we ran CCWS, this was validated. It was the same thing for UBC students, around 30 to 40%. But there's still, we often get the question from leadership, how do you really know and who's really impacted? And so being able to look at some of the demographics and see that there not only is 30 to 40% a concerning number, but for some populations that are at risk or marginalized, there are much higher rates there, and that helps us really target our efforts and report back on progress. And we needed some postdocs and researchers to help make sure that we were understanding the data and sampling considerations and other pieces to make sure that we could do that in a strong evidence-based way. And the last 2 quick points I'll make are that it's really helpful to leverage your institutional research office early in the process. They will help you think through all the technical considerations that come up and help scope out the need for data analysis and reporting. So as much as it's great that CCWS does a lot of that on the back end, you still have to think carefully about how at your campus level you'll use the data, share the data, and analyze the data. And that's a really important group to leverage early. And then also very briefly, we are going through a lot of considerations at the moment around the employee side of things. There are a lot of questions that we could map over, but there are some different considerations. So for example, we probably wouldn't have been able to ask a lot of these kinds of questions if it was run as a UBC survey or out of HR. There just wasn't comfort around asking some questions around health and well-being that could be considered private. And so for employees, we're running it as an anonymous survey. And it's very helpful that it can be seen as an external survey and the data is housed externally. And then we also can talk about how we will use that to enact some change for employees. It's really important that every question we're asking can be linked to why are we actually asking this and how will we make sure that we're taking some action. So we've trimmed back some of the modules with that consideration. And then finally, I think it is really important, and many campuses echo this, that you really think about how this can inform a whole university approach. So even if you're starting with students, it's helpful to think about conversations that go outside of just student health units or student portfolios, but think about how it's moving the mandate of the university forward and can be linked to other areas like academic outcomes. So that it's something that's really helped us make the case and get multiple senior leaders on board and excited about how we leverage the opportunity. So I'll pause there, but I have other specific examples I'm happy to share if there's further questions. Thank you.
Okay, well, thanks, Matt. Thanks, Jeff. So now we have some time for questions for anyone, either for Jeff, Matt, or myself. Kelly, she's the one who knows the actual logistics, the practical stuff. Are there questions in the chat?
We have one question from Britt Harvey, and the question is, at our university, we don't have an institutional research department. Who do you suggest we partner with outside of having this resource?
Well, again, I mean, I think it depends on what you would want to do with the data. You know, we tried with the Tableau, tried to make it as user-friendly as possible. One option is to look at, are there departments, are there graduate students or faculty who might be interested in working with the data. I think, as Matt said, I mean, this is how I found out I got involved with the NCHA data that was collected by University of Toronto in the late 2000s. And, you know, I was excited because here was this large data that I could work with and maybe publish a paper with. So, you know, there may be, you know, pockets within an institution of faculty or students who may be interested in helping with the data because there may be something that they can use for a project, for a course. I'm not sure. Jeff, would you have any other suggestions?
I wasn't sure if the question was about on the data analysis side or on the research ethics side. If they were looking for, so I had different thoughts. I was just watching the chat right now from Brit to see if there was any updates on that. But yeah, it's really like who's interested. There's got to be, this takes a survey like this takes a lot of work, and you need to have some internal champions ready to you know, put their names on it, to put up the funding for it. To help sponsor it and promote it. So, you know, finding those people as high up your organizational chart you can to provide support, regardless of what office they're in. I would take all the support I can get, obviously, on something this big. So.
And Britt, if it's the other, I mean, we have, you know, as Kelly mentioned, we have worked with institutions that don't have a research ethics board. And there are ways that we can work with an institution to work around that challenge.
Great, thank you. We're starting to get more questions in. We've got one from April McInnes. How often is the CCWS recommended to complete longitudinally now and into future years? For example, NCHA was commonly done in Canada every 3 years.
I think it's very much up to the institution to use it as frequently as they find helpful. I mean, I certainly don't think it makes sense to do it every year, but every 2 or 3 years, it probably feels about right, that you've got enough time for instituting programs, policies that you may see have an impact from one time point to another. But we don't have any fixed kind of recommendation, but probably, yeah, 2 or 3 years is probably seems appropriate. We have one institution at the moment who is using the CCWS 3 times in a single year because they're using it to evaluate a very specific initiative. So it's very much up to the institution what makes the most sense for them and how they want to use the data, rather than trying to necessarily get everyone to do the CCWS at the same time. Again, if there's interest in that, then we can support that.
I can just follow up quick. Sorry, I just saw another note from Britt, and the question was less on the REB side, more on the analysis side. I can't underscore how much the Tableau, the work that folks have done, Bindu and Michael have done to really make that so much easier for the.
Sorry, Jeff, we missed that. I think your mic is having.
Oh, sorry. the Tableau again. Sorry, I hate to keep sort of
Jeff,
banging that thing, but Britt, I can't underscore how helpful that Tableau dashboard is and how easy it makes it to answer the questions. Especially you being I assume the health and wellness content expert. You're in some ways or a lot of ways a better person to be going through that Tableau dashboard than someone like me who spends more time thinking about data than I do about health and wellness, if that makes sense. But anyway, I'm happy to answer any questions about that later too.
We have a technical question. Once we get to the point of gathering data, is there a specific window or time frame for getting responses?
Do you mean, so I think that could be Typically the survey is open for 3 weeks, or I think maybe it was on average of 23 days that there's a window for students to complete the survey. That usually has that kind of 3 to 4 reminders built into that. Once data collection is complete, typically we provide data back to institutions within a month of finishing the survey. The tableau takes longer because we're often waiting for all institutions to catch up and to create these benchmarks so that you can compare your institute to a cohort, your province, or to your selected benchmark of like rural colleges, for example. That takes a little bit longer, and somewhere within the region of 2 to 3 months after wrapping up data collection, we're providing the tableau service back. And we'll think that will improve with time as we start to really get to grips with cleaning the data and then kind of integrating it into Tableau, but it takes us a couple of months to do that.
Another question, could you comment further on the response rates, and if the response rates reflect a systematic bias that could influence the interpretation of the data? For example, if very low risk or very high risk students are more likely to participate, that might be important to take into account during outreach or during data analysis or interpretation.
Yes, I think certainly that when the data comes in, you need to kind of carefully review, have consideration of the response rate, and that's I kind of briefly showed that table, for example, where you can look at least comparing who you invited to participate in the survey and who completed the survey. So we find that that's a starting point to look at, are you really getting under or over representation of individuals within your sample? So that's the first consideration. The second one that we did with the BC data was just looking at, well, is what we've turned up with, is it in line with existing Canadian population level data, such as the Canadian Health Measures Survey and the Canadian Community Health Survey? And I gave that one example of the psychological distress, using same measures, and the prevalence was kind of pretty bang on. So again, that kind of gave us some confidence that we didn't, at least in that BC sample, that we didn't see under over representation, even though the response rate was hovering around 18 to 20%. But it's certainly a consideration, and something that we just need to really start to learn from institutions that are doing a good job of response rate and being able to share best practice.
Yeah, if I can just jump in, that specific question was a really important one for us too, especially around food security rates. We were really concerned with the high numbers, and the university was questioning, like, how reliable is this, and was there bias in how people were responding? And so we actually had a postdoc working with researchers try to answer that question specifically, and it was very helpful to be able to see, as Guy said, across other campuses, seeing some similar rates. That was helpful, and also was one of the reasons why having a slightly lower participation rate in our pilot made us want to do the survey again to get some higher numbers, and to make sure that, especially for some of the priority population, development populations, that we had more targeted communication strategies to help get those numbers up. So that's not just the overall average, but we really want to make sure that we're getting a good response rate from some of those groups. So I think that's a really important area, and I'd love to share best practices in that around that as this develops as well.
We might have room for one more question. We have a question. Has there been any thought to using Guarding Minds at Work survey to measure employee mental health?
I'd need to have a look at that. I mean, so what we're trying to do with the CCWS is a core module set of questions that is completed, that is consistent no matter which population completes it, so that you can compare and contrast. So the mental health measures that our students are completing would be the same as completed by employees, so you could make those direct comparisons. So we're kind of hesitant to modify any of the core questions, but I certainly think that the employee version, because we're dropping some of the questions, there is flexibility to add new questions or modules to that survey. And again, we're very happy to work with institutions who have a particular interest in a particular model in integrating it into the CCWS. But thanks for the tip. I'll go and have a look at it this afternoon, because we do need to finalize the employee version quite quickly.
Thank you, Guy. On behalf of BPNet, thank you, Guy, Kelly, Jeff, and Matt. This was a fantastic CCWS session. We have some exciting opportunities coming up. Today, I'd like to share information about our online conference entitled Collaborations for Change, Connecting Research and Practice in Post-Secondary Mental Health. It will take place this coming August 12th and 13th. BPNet is proudly co-hosting this conference with the University of Calgary and with supports from Caucus. The call for proposals closes this Friday. I will post the link for submissions here in the chat. And for more information, please just go to the BPNet website in order to make that happen. 2 days isn't a lot of time, but there is time to get a submission in, and we're very excited about this conference. We will also follow up within the next day or so with today's webinar's recording and evaluation form for your feedback. Please do take the time to complete the evaluation form. The information is very helpful to us. So again, thank you everyone for participating in today's webinar, and we look forward to seeing you soon.